Assalamu alaikum. Today we shall discuss the World Cancer Day uh, on Dr. Hussain Bashkolachi YouTube channel, and we will have the theme in the starting, the theme of 4th February, which is normally the day celebrated as a World Cancer Day by the International Union of Cancer Control. It was decided in Paris in 2000. So this is the 23rd World Cancer Day we are celebrating. I am sharing some of the thoughts related to Pakistan and particularly the cancer patients during the mega floods of 2022 and the climate extreme events as well as the COVID. All these factors have affected the cancer patients very badly, and they are the most sufferer and most neglected section of the population, and that is deprived from the essential care. So let us have this starting slide. And the second is climate change, flood, and cancer burden. As we know that the effects of the flood in Pakistan, total 33 million people, are one third of Pakistan was affected with the flood, and that number is unprecedented. Never in the past history or during the independence, 40s, 50s, 70s, we had some floods and certain climatic conditions, cyclone, but the scale at which this has affected is unprecedented. Even the international community has responded to this emergency, and Pakistan was looked after from international organizations like UNO, WHO, and other international organizations. During March to September, this flood is still beyond that, and certain parts are under flood. Then is the cancer prevalence, which is given by the International Union of Cancer Control, that is 1400.2, approximately 1500 per 100,000 population. So we will calculate this number according to the flood affected in Pakistan. Coming to the situation, of Sindh, where almost 70 million people were affected. And if we calculate the above prevalence rate, then at least 105,000 people were affected. They are all cancer patients. And you can understand this is a huge number. They were deprived of the essential health care, universal health coverage, supply of the medicine, and other follow-up visits were very difficult because of the conditions, road, bridges, houses, and entire infrastructure of the health went under the water. Dawn figure has quoted this figure in whole Pakistan about the new cases about 190,000 or 200,000, which is much less. And if we calculate from the 33 million, then at least about 500,000 or 495,000 people suffering from some kind of the cancer at some stage, whether diagnosed or undiagnosed, were in the flood affected population. So the underestimate and underreporting is one of the big problem. Then coming to the healthcare facilities, Anti-cancer drugs were in short supply. Oncologists were not present in the free medical camps. Shelterless people, comorbidities, helplessness, and loss of uh, properties and the family members was another problem. COVID-19 was also overlapping and still new variant like BF7 and other Omicron variants are also being reported from various cities and COVID is still there and the flood disaster uh, is one of the major uh, problem in Pakistan affecting the economy, health, life, and so on and so forth. Then coming to quickly, the ISRA University, where I am working as a professor of community medicine, and our work is to have the biostatics, statics, epidemiology, as well as research. So we organized 22 camps. Flood victims given medical care were about 10,000, and awareness for prevention from diseases, we reached about 50,000 or half lakh people. 9 districts were covered. Among first responders, we were among the first responders with the health department, army, and other medical caregiver professionals. Over 100 professionals attended the camps from Isra Hospital in 22 camps. Then coming to the quality of public health, and this figure is given that about 2.5 normal range of the air quality is, we call it PM 2.5, that should be 35 micro gram per cubic meter. But when I checked in my mobile phone, Android phone, it was 65 in Hyderabad and 100 in Karachi. So not only the flood at the earth level is affecting, but even the environment and climate and the air quality is not satisfactory. These are the list of the camps where we organize. Then coming to the some of the pictures, this was the first picture, and in the white shalwar kameez, the vice chancellor, and then Professor Asif Barni, myself on the extreme left, and then is the Department of Community Medicine, as well as some of the officials. We started our camp program. Then coming to the some of the worst pictures, these are the hands I am just showing. These are the hands buried in the flood water and the silt. Then you can see this is another picture which shows that how on the rope people are being saved. And then another picture of our camp, how the flood people were checked and given the medical attention and primary and universal health coverage. Some awareness messages to reduce the gap, choose the healthy foods, move more, quit smoking and vaping, cut down all contraband narcotics and liquor, be sun smart and use umbrella to avoid sun rays, get vaccinated against HPV and hepatitis B, HPV only females, cervical and vaginal cancer. And this is the latest vaccine development, and only one shot is recommended in the World Economic Forum panel. Know the sign and symptoms: fatigue, weight changes, lump, any unexplained symptoms. Avoid pollutants and chemicals, particularly asbestos on roofs, pesticides used in agriculture, vegetable, fruits, and grains, and container containing BPA or plastic material. These are the awareness messages which we want to share with the community. And then we appreciate the actress Angela Jolie, one of the world famous actress who visited these camps, and the United Nations Secretary General also visited, and some of the neighboring countries dignitaries, they also visited. The government of Sindh, government of Pakistan, and other organizations, particularly the Sindh government, mobilized a lot of its machinery. So we appreciate whatever the efforts are, but still many parts and many waterways which are occupied or which are being misused, or their flow of the water, particularly in the southern Sindh, Juddo, and towards the sea, and the LBOD drainage system, the old waterways of the Nara Canal and Indus rivers, they need to be restored. So with this, I think I end my YouTube channel will give you some of the important aspects. And today we have discussed World Cancer Day, closing the gap. Thank you very much. Please like it, share it, and send comments to us also.